the Robert Wood Johnson Health Policy Podcast Series, the interview series with the nation's leading experts in health policy. Our guest today is Dr. Nirav Shah, the 15th Commissioner of New York State's Department of Public Health. Welcome, Dr. Shah. So pleased you could join us today.
Thank you.
I wanted to start by saying, in your talk, you catalogued a number of successes that you've managed to achieve in the state of New York. And so I want to start with a hard question. Which one was the hardest and why?
You know, probably the hardest was the entire Medicaid redesign process. When you're taking something that people see as a right. And changing it, everyone is scared. The unions were upset that you're going to cut them out. The patients were upset that you were going to cut out their benefits. Hospitals were upset that you were going to cut them out. Someone had to lose for others to gain. And the reality was, we found a way for everyone to lose just a little, but also gain a lot in the process. It took a lot of effort to build that trust.
Was there an ingredient or theme in that effort? In terms of, you said everybody had to lose. I love that. But was it that people, once they gained, forgot their losses?
Well, when we saw that we were in it together, and the 27 people around the table had traveled the state together in public forums, hearing ideas time and again, there was a camaraderie that built up. So the unions and the hospital management, they were friends by the end of it. And those kinds of things really matter. So then when someone offers something up, and says, we're willing to try this because we know you'll do the right thing, and someone does the right thing, you win. And you build on those little successes over time to make a big change.
What were the things that you were unable to achieve? I mean, New York State is one of the world's largest public health departments. You've achieved incredible stuff. The environment is creative, fertile, ready. You've created change. What were the unsurmountable things in that environment?
Well, I'll give you one example. We talked earlier about supportive housing and how we know we need to make hundreds of millions of dollars of investments in supportive housing and that it'll help the healthcare delivery system. And yet, we can't advance the conversation with the federal government because they don't pay for bricks and mortar, and that is their standard response. And the reality is they do pay, if you look hard enough, for bricks and mortar in different parts of the system. So when things are outside your control and you have no way to influence them and you hit a brick wall every time, how do you change? It's very frustrating sometimes.
I see. And what do you mean by supportive housing?
So supportive housing is housing with some medical or other delivery services built in. So perhaps it's an apartment unit where in the basement there's some substance abuse treatment or some behavioral health counseling or some other services that round out the services the residents need so they can get it right there.
I see. Your vision for the future, your message for other states, what are the key components that make an ecosystem like yours work?
Most people want to do the right thing. They have every intention of doing the right thing. They don't know how to get started. As government, as other stakeholders in the system, if you can build that trust with little wins over time, you can make a lot of change incrementally that add up to changing the whole system. So I believe in the inherent goodness of people and their intentions, and just enabling them, getting out of their way if you're government, or putting them together in the right ways around the right questions can make all the difference.
Well, thank you, Dr. Shah, for both your time and your perspective.
It's been my pleasure.